The emergency department was unusually quiet when a young cyclist arrived, supporting his injured left arm with his right hand. He had fallen directly onto his shoulder after losing control of his bicycle. Every attempt to move his arm caused sharp pain, and a noticeable bump had formed just above his chest. The X-ray revealed the cause immediately: a fractured clavicle. The clavicle, commonly known as the collarbone, is a slender S-shaped bone that stretches horizontally across the upper chest. It connects the upper limb to the trunk by forming joints with the sternum medially and the acromion of the scapula laterally. Although it appears delicate, it serves as a strong strut that keeps the shoulder away from the chest, allowing the arm to move freely through a wide range of motion. On closer examination, the fracture lay in the middle third of the clavicle, the weakest portion of the bone and the site where most clavicular fractures occur. Unlike the thicker medial and lateral ends, the middle shaft lacks strong muscular reinforcement, making it more vulnerable to injury. Several important muscles are attached to the clavicle. The sternocleidomastoid muscle inserts on the medial end and often pulls the inner fragment upward after a fracture. The pectoralis major originates from the anterior surface of the medial half, while the deltoid and trapezius attach laterally, helping move and stabilize the shoulder. The subclavius muscle lies beneath the clavicle, providing support and helping protect important structures below. Those structures include the subclavian artery and vein, along with the trunks of the brachial plexus, which pass just beneath the clavicle on their way to the upper limb. Fortunately, the patient's fracture had not damaged these vital vessels or nerves, but every clavicle injury must be assessed carefully because severe displacement can place them at risk. The clavicle is supplied mainly by branches of the suprascapular and thoracoacromial arteries, which support healing after injury. Like all bones, it also receives blood from nutrient vessels that enter the shaft. After examining the X-ray, the orthopedic surgeon recommended treatment with a sling since the fracture was well aligned. Surgery was unnecessary because there was no injury to the surrounding nerves or blood vessels. With proper rest, gradual rehabilitation, and time, the bone would heal. As the patient left the hospital, he realized that the small bone he had barely noticed before played one of the most important roles in supporting every lift, reach, and movement of his arm. The clavicle may be small, but it plays a vital role in every movement of your shoulder and arm. If you found this story helpful, like the video, share it with your classmates and friends, and follow for more engaging anatomy stories that make learning medicine simple and memorable.